People ask about the technology. Now, I've been doing this for about 20 years, and I started when the very first lasers came on the market about 20 years ago. Since then I've done about 20,000 eyes, and the technology has improved massively since then. In fact, the modern day third and fourth generation lasers like we have here at Visualase are very straightforward and give very good results with very few complications. And also, in terms of retreatments where people are not quite spot on, for short sight, for example, it's only about 1 or 2%. With LASIK, we put a little machine called a microkeratome on the eye. It sucks on and goes bzzz and makes a little flap. That only takes a couple of seconds. Then we lift the flap and do the laser. That's 5 to 20 seconds, lots of flashing lights. Put the flap down, put a few drops in, that's all finished. With LASIK, that's the surface laser, you put a little well on top of the eye and put some dilute alcohol in. It's like martini really. Leave it for half a minute, just suck it off. And then we can push this top skin layer back, the epithelium, to one side, do exactly the same laser as the LASIK, and put the slightly alcohol damaged epithelium back again and a blank contact lens over the weekend. LASIK is nicer for the patient because there's little pain, very quick visual rehabilitation, so you're up and running almost from 3 or 4 hours later. The LASIK, because it has to replace the top layer, takes longer to recover. It's a bit more gritty and a bit painful sometimes post-op, but after a week it's exactly the same result. So they have different risk profiles. It's like going to London. You can go on the train or the plane or the bus. You'll get there with slightly different risk profiles. People often ask, how long does this laser treatment take? This is a very fast laser, so on average the actual laser time is somewhere between 5 and 20 seconds on average. That's to do the actual laser. If we're doing LASIK where we make a flap, that's another 5 seconds. So in all, the whole treatment really is less than 30 seconds. So there is some preparation where we clean up the eye and put some anaesthetic in and all that sort of stuff, but the whole thing for each eye takes about 10 minutes. Other patients ask about safety, and I think it's a little bit like the analogy of either being in a plane or in a car. Now, psychologically you think a plane is a lot more dangerous than a car, but in fact it's quite the reverse. And the same with the laser. I mean, it's at least as safe as wearing contact lenses, if not a bit safer. For example, I've done about 20,000 treatments and I've had 1 infection. Whereas with contact lenses, when I was at the eye hospital in Manchester, we saw loads. Okay, most people don't have a problem, but there's such a large volume that you can get these things. So I'll say to people, you know, every surgery has small risks, but they are quite small. Yes, the people talk about risk, and is it just as safe to do 2 eyes on the same day or to do them several weeks apart? Generally speaking, it's probably just as safe to do them on the same day, and I've got quite a number of colleagues, ophthalmologists, who've had this done on themselves, who've all had it done on the same day. In the past with PRK, it took quite a long time to settle down, and so we did them a few weeks apart. And even now, if we're doing surface laser, that's LASIK, and you're quite a high prescription, say about -8, we would tend to space it a couple of weeks apart because the vision takes a little bit longer to recover. But for all LASIK and up to about -5 with LASIK for short sight, we do them on the same day. The final frontier in refractive surgery is the problem of presbyopia, which is the inability to read as you get older. The lens in your eye puts on layers like an onion all your life and gets a bit harder, so you get to about 50 and it doesn't squash up as much for reading, so then people begin to need reading specs. Now the ultimate answer is to replace the lens with some sort of flexible thing equivalent to what's in a young person. Nobody knows how to do that yet. So every solution is a sort of slight fudge. One we use an awful lot here, and one which I got myself personally, is to use monovision, and that's to have one eye for distance, and the other one just slightly short-sighted, -1 to 1.5, that will get you by for reading for most things without degrading your distance vision too much. One of the few things about getting older that helps us, one is we possibly get wiser, the other one is we get smaller pupils, so it's more forgiving, and that helps a lot with monovision. A cataract is where the lens inside the eye goes cloudy and you can't see through it. It's a bit like the lens in a camera. So it's not the very front, it's inside the camera, and it gets dirty. So at the front you've got the cornea, which is like a little window on the eye, and then behind the pupil, which is the one that goes up and down like that, is the lens. And the lens puts on layers like an onion all your life and gets a bit harder and a bit less flexible. So of all the structures in the eye, the lens is the one that ages, really. And beyond 60 and certainly beyond 70, it's getting yellower, and maybe not a cataract, but it's showing its age. People ask about what happens if I move my eye during the treatment. Well, this laser is firing at 400 Hz, which is 400 times a second, but it has an infrared tracking system that locks onto your eye, and that tracks the eye even faster. So if you move your eye, even a moderate amount, the laser just follows you and carries on. If you totally lost your bottle and looked away right at the side, it would just stop, and then when you look back again and it got you, it would just carry on. Right, if you've had LASIK, that's a surface laser, as soon as the top layer is healed, that's the epithelium, the skin on the top, you can do whatever you want. So that's 4 or 5 days at the most. For LASIK, we tell the girls eye makeup a week, swimming without goggles a couple of weeks, and contact sports a month. What you don't want to do is to buff the eye with LASIK with an oblique blow in the first few weeks, because that could just move the flap a little bit. But usually after about a month you can do almost anything.